See, I remember you. Yeah. Okay, don't pull her hair.
For Jordan Hofstedler Rowe, the birth of her daughter Micah, now 7 months old, was a lifelong dream come true, but a dream with underlying fear.
Throughout my life, I knew I wanted to be a mom. I wasn't aware of all of the issues that Black women specifically face in my earlier adult years, but I distinctly remember hearing about Serena Williams when she gave birth to her first child and how she had to really advocate for herself and make sure that she was taken care of and that she could have easily died. And people weren't believing her and were minimizing what she was describing, and that felt terrifying to me.
Her care team includes certified midwife Denise Washington, who is on the front lines of maternal health care in Texas.
What else do you see in here?
Pregnancy, childbirth is pre-programmed in every woman. That is how we were designed. Of course, they didn't give us an instruction manual.
Texas ranks near the bottom among U.S. states in maternal mortality, according to research from the Commonwealth Fund. And the Texas Department of State Health Services reports that Black women are 2.5 times more likely to die than white women during or soon after a pregnancy. Data from 2019 and 2020 shows deaths increasing for Black women, up to 39 per 100,000 births, while the death rate declined for white women. Advocates like birth justice activist Sarita Fontanese, who is 18 weeks pregnant, birth workers like doula Ebony Williams, and physician leaders like Dr. Carla Ortiz, chair of the Texas Maternal Mortality and Morbidity Review Committee, all point to the same underlying cause of the higher risk of death for Black women.
The short answer is racism, right? and long systemic racism and discrediting and not believing Black women. You know, Texas crown jewel Beyonce has even talked about her incredibly traumatic and trying times during pregnancy. And if Beyonce is struggling, what are the rest of us supposed to be doing, right?
We've identified that it is mostly due to systemic, right? Systemic racism, systemic policies that have been put into place that Black women or Black birthing families have more of a disadvantage to.
It's the institutional racism and prejudice that exist not only in our education system, but also in our legal system. Every system that was created in this country has some historic marginalization of Black people.
So what is systemic racism? Some question that it even exists at all. It's not being in the Ku Klux Klan or calling someone a slur. That's overt racism. It's easy to see. Systemic racism can be subtle, less discernible, especially if you are not on the receiving end of it. That's according to sociologists, historians, and researchers, and the women we talk to. It's about being uniquely disadvantaged. Doctors and nurses aren't shouting the N-word at pregnant Black women, but in the maternal care system in Texas, their risk of death is far higher than that of white women.
If you have over decades not allowed access to health care, not allowed access to safe environments, not allowed access to areas that are not food deserts, not allowed access to areas where, as I said, safe to exercise, different schools based on tax base. You are forced to live in an area where your schools are not as good, then over time, a people becomes negatively impacted.
In 1998, Washington was homeless, a teenager, and pregnant. She safely gave birth in a hospital, but without family and community support. That frightening, lonely experience led her to a career as a birth worker, and she says, to firsthand encounters with systemic racism.
I've gone to the hospital as a student midwife with my preceptor with a white client, and the energy is completely different. They want to cater to this woman. Do you need anything? Are you okay? Are you feeling uncomfortable? Like they are hands and knees catering to this woman. But when I come in with my Black doula clients, the energy is trying to hurry up and get in and get out. Oh, they're fine. They don't need it. Just get the epidural and lay down. You'll be okay. And that is to see it and have to live with it and deal with it and know that it's still around, it's just crazy to me. I hate to say that. I hate to think I'm being treated differently or my client is being treated differently because I am Black. But I know it's true.
There's no single solution to making birth safer for Black women, but these experts say doula and midwife care fills gaps in the traditional care system.
Midwifery is not set up in the traditional medical way. So, and even with just having a doula, like, it's not traditional Western medicine. So it is, you know, cultural-based medicine from Africa, from the indigenous people of this country.
A doula is a support person during the perinatal period, so prenatal, birth, and postpartum. We are not medical practitioners. However, we're there to provide emotional, physical, resource support. We're not that medical authoritative figure. So we tend to be able to be a friend, someone that they trust, that they're able to open up to and be vulnerable with. So we're able to a lot of times build that relationship with our clients that most times they're not able to build with their provider.
In March, a coalition of advocates organized by Giving Austin Labor Support, or GALS, met before visiting lawmakers at the state capitol. They want Texas to allow doulas to earn more reimbursement from Medicaid so that more women at risk can get needed support. But even women with resources and good health insurance worry.
I am tremendously grateful for my care team at Texas Children's, both my OB and the maternal fetal medicine team. And also, as great and wonderful as there are, it's still really terrifying to be pregnant right now in Texas.
She's like, who are these people? Who are these people?
I felt more excitement, more joy.
Meanwhile, Micah was fortunate to come into this world safely and surrounded by the type of care and support that her mother chose, something any mother would want.
I really wanted the energy of the room to feel calm, to feel welcoming, and to feel focused on her. And I had that. It was really, really, really great. Yeah, hi.
Yeah. You're getting so strong.
So yeah, I like to scoot now. I can scoot backwards on my tummy.
Thanks so much for watching. If you like this video, be sure to subscribe for more from Austin Insight.
You can also watch full episodes of Austin Insight for free on the PBS app.